So let me go ahead and give a brief introduction to the first group of speakers for today. Tom Farrey will start off. He's the executive director of the Aspen Institute Sports and Society program. He'll be followed by Bruce Lee, who's professor of health policy and management at the City University of New York School of Public Health. And then he will be followed by Pathik, who is the CEO and founder of the Sports Facilities Companies. Please join me in welcoming Tom, Bruce, and Dev.
Thanks, Jamy. Really great to be here, and thank you to the roundtable and everyone who put this together. It's really exciting to tell you about our work, and hopefully there are a few learnings that you can take away from our little effort to organize our small/large corner of the universe in service of building healthy communities through sport and addressing the obesity crisis in this country. You know, this Project Play started. It started with a conversation around obesity and the physical activity piece, and specifically the sport activity piece within the physical activity piece. And how do we get that space organized in a manner that it can help get more kids physically active on a regular basis and therefore make a meaningful contribution to addressing the obesity crisis in this country. It started actually with a grant from the Robert Wood Johnson Foundation. And since then, we've had other groups, Hospital for Special Surgery, American College of Sports Medicine, a number of health and medical organizations part of our work. So let me just kind of work you through it here. Am I going to tell you to flip the slides here, Leslie or somebody?
Yeah.
Great. Thank you. Okay. So first of all, even before I get to the slide here, the first thing you need to know about is the mission of Project Play is to help stakeholders build healthy communities through sport. Help stakeholders build healthy communities through sport. Sometimes Project Play is misperceived, even by our own stakeholders, as an effort to simply grow sport participation in this country. And we do want that to happen. We want more kids playing sports, both organized and in unstructured ways. However, that word healthy is a governor for it. So there are times when our agenda is not necessarily the same as those in the youth sports space. So for instance, tackle football. Do we need 5-year-olds and 6-year-olds banging their heads against each other at such an early age? Does the evidence suggest that it'd be smarter to wait into the teenage years? We've come down with that type of recommendation. Other times with COVID, for instance, the youth sport was the last sport institution to shut down and was the first to start back up again. And that was, in early May when they started throwing these travel tournaments all over the place. And our perspective is, look, hold off, folks. Here, physical activity is good, but we need to do this in a manner that is consistent with the needs of public health. So just a little point of clarity as we move forward here. All right, so what Project Play really is an attempt to just organize our sports system in a manner that is going to produce more optimal health outcomes. Well, we knew that we couldn't boil the ocean, that we had to start someplace. So the first, if you can go back one slide, the step one really for phase one for us was really getting it right at 12 and under. How do we make sure every child, regardless of zip code or ability, has the opportunity to play sports in this country, right? Again, organized or free play. So let's focus all of our stakeholders, all of the convening power of the Aspen Institute around that question. At the start. Go to the next slide, please. So step one in our process was really just organizing the knowledge, looking at the research that was already out there around the benefits of physical activity and sport activity, so we could begin to speak with stakeholders. You can go to the next slide. Great. So we can begin to speak to the range of stakeholders about the benefits of physical activity and why this needs to be a high public priority. Because we know, and this originally came from research from Design to Move, and we've updated it since then, that physically active kids are 1/10 as likely to be obese. They do better in school. They smoke less. Girls have lower pregnancy rates. They're more likely to go on to college. They have higher self-esteem. They have lower health costs. They're more productive at work. They have lower incidence of chronic diseases, including about 20 different types of cancer, and they're more likely to become active parents. And because they're active parents, they're good role models for their kids. They're more likely to have active kids. So there's this incredibly virtuous cycle that you can create if we can simply get kids off the couch without running them into the ground by the age of 12, and we apply a strong equity lens to this work. So we created this infographic, or actually, again, Design to Move created it. We've updated it since then, and we have pushed it out to the range of stakeholders to say, listen, you need to be in this conversation. You cannot rely just on the sports sector to figure this out. Okay, next slide, please. We've also since created a active communities do better graph. This is actually fairly recent here. But what the research shows on the benefits to residents, we look at the American Fitness Index as put together by the American College of Sports Medicine, and started, looking at, how those cities did in certain areas. I'm not going to read all those you can see there, but communities that are active, that invest in physical activity and are higher property values. People generally do better in terms of health on a population level. Kids graduate more often. So these are very important and powerful documents to bringing, to enlarging your conversation, which has been really key to the success of Project Play. Next slide, please. And by the way, you're welcome to have any of these infographics. They're on our website, projectplay.us. We encourage people to download them, distribute them to whatever stakeholders you feel are appropriate. So what we did then is, okay, if that's the argument for physical activity and sport activity, how do we develop a framework or a playbook on how to, build toward this motto, sport for all, play for life, which is over my shoulder here. We've got the Project Play Summit coming up, so this looks like a TV studio of sorts. Just propped it up. So this thing came out. This basically, we listened to people in 2015. We listened to people for 2 years, 300 leaders, about 10 to 12 roundtables all over the country on a range of topics. We surfaced the best ideas and we shrunk them down into this very attractive, easy to read document that is, it's a white paper, but it's a white paper for people who don't read white papers. And we feel that's really super important in any conversation here, is to get out of your academic self and really translate this stuff into language that people can understand. Shrink it down. It's great having Nike, which is a partner of ours in this, with all of their marketing know-how. That was their advice. Make it nice and tight and say it over and over and over and over again, and people will understand what your ideas are. So that's what we did. This is based in the values. We're very explicit about it, of health and inclusion. And inclusion we define as broadly. So that just means every kid deserves an opportunity to play sport. And it has 8 strategies for the 8 sectors that touch the lives of kids. And it has 40 plus activation ideas for those 8 sectors. So if you're a leader in that sector, if you're an organization, you can go, and here are several very crisp tactical things you can do at the outset. And many of them have taken those ideas and run with them. Okay, next slide. So the 8 sectors, and again, it was very important for us to name them. These are the sectors that touch the lives of children from the moment they wake up to the moment they go to sleep. Because if you just try to get community recreation to get their act in order, but they're getting conflicting message from public health or from their parents or from national sport organizations or policymakers, it's only going to be so effective. In fact, it's not going to be very effective at all. So we've got to have these sectors in the conversation, and people singing off of basically the same thing, the same hymn sheet. And the vision we've laid out, and we push this out to everybody, is an America in which all children have the opportunity to be active through sports. Next slide, please. So, and then we named our 8 strategies, or our 8 plays. Again, shrunk them down. And none of these are rocket science, and that's okay. And none of them were originally thought up by the Aspen Institute or myself. These all came from. These are all ideas or themes that emerged in the course of our roundtables. We just wanted to put together, a set of strategies that could get their heads nodding, They got them at a glance, and they could begin to develop the partnerships and the policies and the practices that would, get and keep more kids active through sports. So I'm not going to go deep on each one of them, but very quickly, ask kids what they want is simply a request to put children at the center of the design of these experiences. Youth sports, we call it youth sports, but it's really designed by adults for adults. We rarely bring the voice of children into it. We rarely say, hey, what do you want? What does good look like? What are your goals for this year? What kind of experience do you want? So how do we systematically do that? We're developing surveys now that can be passed out electronically and create those feedback loops so organizations can create experiences that are a lot stickier. This is something that the video game companies do. They reach kids and give them competition experiences that they want because they're monitoring their feedback loop. So how do we introduce that to youth sports? Reintroduce free play. Enough said. You understand what that means. Encourage sport sampling, which means multi-sport play, and pushing back on this trend of asking kids to focus on one sport at a very early age. But it also means introducing kids in underserved communities to a wider variety of sports than they're typically introduced to. Often it's just basketball and football, and maybe one or two other sports. There are 120 different sports out there. How do we connect them to that local rowing club or that fencing club or, various experiences that they might enjoy and actually be pretty good at? So how can we think strategically about that? The fourth is revitalizing in-town leagues. As any of you who've been involved with youth sports know, the travel team environment has really kind of transformed youth sports over the past 20 years. We've become a nation of sport haves and have-nots, depending largely on whether you have the money for club teams and the ability to travel, depending on whether you have a two-parent home, some parent who can take that car ride for you and get you to the endless array of practices and otherwise. We know that local community-based play that kids can ride their bike to, that's low cost, where they're playing with their classmates, not kids from another county away. That kind of experience will grow participation. It will deliver many of the benefits of sports that we want all kids to receive. So you're going to see an extreme focus on that one moving forward with us in Project Play, given the challenges that our country is facing right now. Think Small is about play spaces, using those spaces in your community most creatively through shared use agreements, through whatever, working with businesses to, hey, can we use your grass here to set up fields, etc. Number 6 is design for development, which is really just a plea to anchor a system in our sports system in the principles of age appropriate or developmentally appropriate play. 6 is not 16. You can't coach a kid the same way. There needs to be some knowledge about what they can handle physically, mentally, emotionally, right? We have and that ties into number 7, which is train all coaches. We've made real progress on this. I can talk about this a little bit later, but traditionally we've been a nation of well-meaning volunteers who've been winging it. We don't ask them to get trained in any of the key competencies in working with kids, just as we do with elementary school teachers who spend sometimes less time with kids than coaches do. So how do we give coaches the tools to make sure it's a good experience for kids and that they develop? And number 8 is emphasize prevention. This is really born from the concussion crisis. A lot of parents were saying, you know what? I'm not sure sports is a good thing for my kid. So we had to recognize that was a barrier to participation. So how can we give parents and kids the confidence that this is going to be an experience that is going to build health and not break you down? But it also gets into areas of emotional injury and so forth. So those are the 8 strategies. Next slide. So this is the aspirational model that we put before everyone, again, to get them on the page. And we say, hey, look, sport in this country is really kind of youth sports is a pyramid. You might have 60, 70% of kids signing up for youth sport, organized sports at 5, 6, 7 years old. And then we create these travel teams when they're in 2nd and 3rd and 4th grade. And we structurally begin to push kids aside. And we're saying, no, that is not a model for what good looks like. This is a model that we should all be aiming for, because all of us will benefit if we adhere to it. And so it's a model in which physical literacy is the priority, at least up through age 12. So, focus on ability, confidence, and desire to be active. It's a definition that we developed with a project that was funded by Robert Wood Johnson Foundation, and it's fundamental movement skills. It's love of game. The idea is if kids, if their bodies are in motion and they enjoy themselves, they have some level of confidence. They have an experience. They're not going to want to let it go, regardless of whether they want to become like Olympians or pro athletes, or they just want to play at a competitive high school level, or they just want to, be active and play on the company softball team when they're 22 and 23 years old. If we commit to a model in which physical literacy is the priority up through age 12, every stakeholder within the system and all of the population will benefit. So that's the thing we try to get people to focus on. Next slide. So step 2, now that we've kind of had this document that we continually put in front of people and these different models, is okay, well, how do you mobilize the organization? So that's what we can go to the next slide here. So the first thing we did is the Surgeon General, Dr. Murthy at the time, came to the first Project Play Summit, read it, and made that office's first ever comments on the value of youth sports in building physical activity and public health. There had been language in the past about the benefits of physical activity, but nothing meaningful or serious about, hey, this is a real opportunity for us. So very grateful for Dr. Murthy and his leadership there. And it was essentially a call to action at the first Project Play Summit. He said, look, you need to take this out into communities now. And so we said, I got it. And we did that. If you go to the next slide, please. So what we did is we took these very high level ideas and this high level concept and began to apply them at the geographic community level. So here are 6 of the 10 communities that we have landscaped to date. So what we do is we go into these communities and we say, okay, well, how are you doing in terms of training coaches? How are you doing in terms of free play? How are you doing it with your play spaces? And we basically do an audit. We give them a document, a 40-page document. You can see this is one of those we did with Southeast Michigan and the Ralph C. Wilson Jr. Foundation. And so what they did then is, now that they had a snapshot of some kind of benchmark of where they were, they could begin to design investments and policies and get people around the table and help them set priorities. And that's what the Wilson Foundation, along with the community foundations in Buffalo and in Detroit and Rochester did, which is they created these task forces. They said, okay, here's your document. Where do you see the opportunity? Terrific. Now, how do we build some coalitions? How do we build some programs? How do we share knowledge? How can we begin to really activate and improve the quality of play in our communities? And the Wilson Foundation has invested, north of $50 million in youth sport grants, shaped largely by the ideas in these reports, along with the priorities of the task force. Go to the next slide, please. And we also bring people together to share knowledge, right? And so we feel this is an important part of the process. And our big event each year is the Project Play Summit. Again, we're very intentional about reaching out to the leaders from those 8 different sectors. We bring people together. There's an incredible energy in that room when, unfortunately, we can't do it this year. It's online, but it's amazing what people, the experience they have at an event like this. We share tools, projects, resources. We release our annual National State of Play report with the latest data. We are very data driven. We work with the Sports and Fitness Industry Association to capture specific data related to kids ages 6 to 12 and 13 to 17 across sports, income levels, gender, all of it. And we can see the trend lines, and we ask folks, okay, well, how do we improve this line or that line? We have a series of workshops as well. Okay. Next slide. And so then in 2017, we said, what, we have a pretty broad network, and our network now is about 20,000 organizations dialed into our work. who get our newsletter, and hundreds come to our Project Play Summit each year. But how do we get like the big dogs in the table? How can we get the organizations that can really move the chains if they have a deeper conversation around building healthy communities through sports? So we created something called Project Play 2020 in 2017, and many of these are competitors. And we asked them to get around the table and say, hey, look, set aside your competitive impulses when it comes to 12 and under, but if we can all invest in getting all kids active through age 12, all of your boats will be lifted. And it's been pretty effective. You've seen some amazing things happen as these people have created conversations and developed initiatives. Next slide, please. One of the things they've created is howtocoachkids.org, which is the nation's first free resource aggregating coaching materials that any organization anywhere can use to push out to their coaches. So that was developed by Nike and the U.S. Olympic Committee, and Aspen was a partner in this as well. So next thing. We also created the Healthy Sport Index with the Hospital for Special Surgery. And because we know that parents want and stakeholders deserve to know which sports produce the best outcomes for certain types of kids. So we looked at the top 10 sports at the high school level for boys and for girls. And then we assembled a blue ribbon committee of researchers to aggregate the information around physical activity in each of those sports. If you can go to the next slide, please. Physical activity in each sport, the safety, so injury rates in each sport, and then psychosocial development. Now, some of this data we had to do through original research ourselves, but we put it all in there. We had the expert committee evaluate it and weight it, and then offer some additional expert opinion, and then created this website, a Healthy Sport Index, that allows you to adjust that dial you just saw and figure out the sports that might be best suited for your kids. So, if physical activity is a real priority, well, your kid's stuck on the couch, then, these are sports that you should be thinking about. And here's a deep level of information. If you click, you don't need it, but if you click on that, it'll go to, you'll see all sorts of information that's hopefully useful. But psychosocial, if your kid's sort of lonely and you really want them to connect with other kids, there are certain sports that the research shows is you might want to think about. Next slide. So step 3 was mobilizing the parents. So the Healthy Sport Index was really kind of step 1 in that, just creating a resource that they could really drive to. We also created parent checklists and all sorts of other materials, but last year, you can go to the next slide, please. We introduced Don't Retire Kid, which is a media campaign that Kobe Bryant and ESPN helped us launch. It got hundreds of millions of impressions. And our theory here was that, we started with the people who run these organizations and can set policy and practices, but ultimately, maybe the key agent in this thing are parents. So this was our big campaign to get out to people that, hey, look, there's a real problem with kids quitting sports. By our research, 2.9 years on average. That's most they play. They're done typically by age 11. They're cycling out way too early. You need to know this is a problem, and here are a set of resources for you to begin to address it. So we just attacked this from a variety of angles, as you can tell. And we've, we found a good bit of success. The new numbers are terrific that we're going to release in early October.
So thanks, Tom. So Tom basically outlined, as he mentioned, the initial premise of Project Play is straightforward in terms of tackling the physical inactivity epidemic among youth and also increasing youth sports participation and working with communities. But the actual operations and the actual scope of the problem are actually quite complex, which requires a very high energy, highly organized, highly coordinated complex operation like Project Play. And one of the challenges is that decision makers really need numbers to understand the magnitude and scope of the problem in order to determine where it falls on a list of priorities. So, you can say, okay, that makes sense. We need to increase youth physical activity. Sports has all these benefits, et cetera. But the challenge is that decision makers aren't sitting there in isolation with just one problem. They have a host of different issues that they have to deal with, ranging from economic problems to social problems to other health problems, et cetera. So it is very helpful to quantify the impact and size of the problem, as well as the value of different types of interventions. So, because again, this problem is complex. So next slide, please. So when we talk about complexity, and we felt that it's useful for Tom to really lay out the entire issue and the problem, and then the scope of the operation and Project Play. To tackle complexity can be challenging unaided. So if as humans we can see direct effects, we might be able to see secondary effects, but when you go beyond that, it gets complicated. So we need help in terms of understanding what's going on and understanding the potential value of different policies and interventions. So in order to do that, we've created a suite of models entitled Virtual Populations for Obesity Prevention. These could be considered a SimCity for obesity prevention. When we talk about obesity, we're talking about nutrition, diet, physical activity, all those things that may contribute to obesity-related health issues or weight-related health issues or BMI-related health issues. And these are agent-based models. And agent-based models are basically, just to quickly define them, models in which you have these computational agents. They may represent an individual person. So in the case of our model, we're representing individual people. And these individual people have two characteristics. One is they have autonomous decision-making. In other words, each person can make his or her decision independent of others. They can be influenced by others, but ultimately he or she has freedom of choice. And the second feature of agent-based models is complex adaptive learning. So basic complex adaptive behavior. Each of these agents can learn from the past or do things differently, or what happens to these agents depends on what happens in the past. So in the cases of our population, we used a synthetic population that was built using census data, and each agent, just like a real person, can have a range of characteristics. So an age, a gender, race, ethnicity, socioeconomic status, home assignment, school assignment, height, weight, etc. So we initially built a model of Baltimore, but then we used the same structure to build models of various different cities as well as the entire United States. So next slide, please. So basically, each of these agents, you can program in different types of activities and behaviors and decisions throughout the day, just like a real person. So the agent can wake up, the agent can eat food, walk to a location, engage in physical activity, et cetera. So this is just an example of a sample schedule that an agent may have. Next slide. So each agent also has embedded within himself or herself a personalized metabolic model. So what do we mean by personalized metabolic model? Well, we're trying to represent what actually happens within the body, within the physiology within the body. So for instance, if an agent eats a meal, then he or she will ingest calories, and those calories then will be processed through all these biological mechanisms into fat mass and fat-free mass. And ultimately, each day that agent may increase in weight or decrease in weight, depending on how many calories are expended. So at the same time, the agent may participate in physical activity or walk around and expend calories. And over time, that agent's body mass index will change because the agent is also growing. If that agent is a youth agent, for instance, if that agent is 10 years old, then the agent then will continue to be growing in height, as well as his or her weight may be changing. So therefore, the BMI changes over time, the body mass index. So next slide. So we basically then attached this metabolic model and then all the agent characteristics to an embedded clinical outcomes model. So basically, we tried to represent key health conditions that may be associated with changes in body mass index. So for instance, each agent had probabilities of developing diabetes or cardiovascular disease or cancer over time. And then if that person developed different types of chronic medical conditions, then he or she had probabilities of developing different outcomes. Like that person, if that person had cardiovascular disease, that person may have a heart attack or a stroke, or if the person had diabetes, that may progress to more uncontrolled diabetes. And all along the way, with each different condition, that agent can consume different types of healthcare resources or use different types of healthcare resources like hospitalizations or tests, et cetera. So if you look at the next slide, this model itself, this embedded model, was published in the journal Obesity. You can see the different health states. In the interest of time, I'm not going to go through each of these different health states, but they're associated BMI and health states. Okay, next slide. And therefore, we basically combine all of these into a general model of the United States representing all the youth within the United States. And the results of this was published in Health Affairs. And so therefore, what we did was we created an entire population of all the youth in the United States, and then that simulated their daily activities, their daily physical activity, and the daily meals and calories that they ingested. And we look at what would happen over time if they continue at the current levels of physical activity, and then later look at what happened if they increase the level of physical activity. So next slide. And the results of this were covered by, received significant media attention from New York Times, Forbes, USA Today, et cetera. Next slide. Okay, so this is what happened basically in terms of the different types of the costs associated with different conditions. So next slide. So basically, if you look at the current situation, roughly about a third or less than a third of youth in the United States are getting the recommended daily physical activity or weekly physical activity based on the Sports Fitness Industry Authority, SFIA, recommendations. So the recommendations is an active to a healthy level of physical activity, which basically means 20 minutes of physical activity 3 times a week. So if you think about it, not a very high threshold. So youth should get at least 20 minutes of physical activity 3 times a week. Less than a third of youth currently, or at least when we started this project, was reaching that level. So this graph basically shows what would happen if you increase that less than a third to 50%, to 75%, to 100%, or levels in between. So if you look at this graph, you can see that on the x-axis is the percent achieving that physical activity level, and on the y-axis are the billions of dollars of savings. So again, we ran this model on the current situation and then calculate all the associated direct medical costs, the healthcare costs, and then and also the lost productivity. And then we said, okay, what happens if you increase the physical activity of the youth to these different levels? And this is basically the billions of dollars of savings. So you can see the lower bracket shows what happens when you increase the percent achieving that previous index that I mentioned, the SFIA threshold. And then the upper bracket shows what happens if you increase the percentage of people achieving the CDC recommended levels, which is a little bit higher, but nonetheless not an unachievable threshold. You're talking about billions of dollars of savings. And not only billions of dollars savings at one time, every time you have a new set of youth occupying, so in this case, we're defining youth as 10-year-olds to 14-year-olds, a new set, then you're saving those billions of dollars over time once again. So you can see over and over again, the amount of savings is billions and then upon billions and then trillions, et cetera. It all ultimately will add up quite significantly. Next slide. And then we also looked here at what would happen if you change the type of physical activity, like for instance, if you change it from slow walking, up to running. So as you can see along the x-axis, you have different types of physical activity. And of course, the more vigorous the physical activity gets, the greater the amounts of savings. So here we see total costs, lost productivity, medical care costs, et cetera, and the changes in buildings from the baselines, which I had indicated before in the previous slide. So again, the punchline is that you can save billions of dollars. You get the youth even more active with more active sports. That savings even goes up even further. So next slide. And then so the next several slides basically just capture some of these results. So if you click on the this slide, you'll get the billions of dollars averted. If 50% of youth achieve the CDC level, that's 11.4 billion, 25.1 billion productivity losses averted, 5.9 million years of life saved. Next. And then same thing, we click through this, we show what happens if 100% of youth reach the CDC level. Again, not unachievable because the threshold is not exactly high. All these billions of dollars of savings. And next slide. And then we did this specifically for different areas of Project Play. I won't go through each of these numbers, but you can see based on these charts, what happens if we implement increases in youth physical activity, youth sports participation in the Southeast Michigan area, because this is a particular area of interest for the Ralph Wilson Foundation. And that was part of the State of Play report for Southeast Michigan. Next slide. And same thing for Western New York. So again, you could also drill down to different locations, different populations, different areas. And then these are locations where there are significant disparities, where you can see that people in low-income neighborhoods, which in many cases have higher percentages of persons of color, have less access to youth sports. They may have fewer facilities, they may not have as many coaches, sports can cost money to play, so they don't have as much financial resources, they may not have as many mentors and role models, etc. So again, I mentioned facilities, so that basically segues, next slide. And then next slide, this is another area, location. And that basically segues to what Dev will be talking about. So as mentioned at the beginning by Jamy at the beginning of this segment, Dev has been a key partner within Project Play, and he can describe some of the approaches that he uses, as well as Project Play in general uses, to really work with different types of stakeholders, local stakeholders, when establishing things that are needed, such as facilities, to help youth participate in sports. So with that, I'm going to hand over the virtual microphone over to Dev.
Thank you, Bruce, and always a pleasure to follow you and Tom, and we've been so inspired by your work, and I think we're a good example of how practitioners can react to a systems modeling approach. We have altered and innovated our approaches as a result of the work of the Aspen Institute and Dr. Lee. Briefly, our mission is to improve the health and the economic vitality of the communities we serve, and we do that by planning, helping to secure funding for, developing where necessary, and operating youth and amateur and community-based sport and recreation facilities. Over 2,000 municipalities since our founding in 2003, and we are the only strategic partner to the International City Managers Association in anything sport or parks and recs. That's because we advise municipalities on how to allocate resources related to sport and rec. And we do that using a research process, a market research-driven process. But we now do that with much more intention given to low income and to providing access to all, because we've come to learn that the impacts of sport are so significant. So you see in this slide a summary. It's our layering in of how sport really impacts outcomes. You saw this earlier from Tom. We can go on to the next. To talk about the world we live in the world of developing infrastructure and helping municipalities and large institutions determine what infrastructure is necessary to activate their objectives around sport. As we educate communities, we often think about these 5 key factors as it relates to access, so that in the discussions we can consider how infrastructure plays a role in these access factors. all of these intended to improve health and social outcomes for kids. So the first is safe and free places to play. It's great to have these, extraordinary sports facilities that are being developed across the country, and we're involved in a lot of them. But what matters is that people have a safe enough neighborhood so that they can move about in that neighborhood, and then to have a safe place where they can recreate. The second piece is that the urban design needs to be activity focused. And this is really, Bruce talks about this, but this is really about the interconnectivity of the recreation and sports assets. It's about walkability. It's about safe places to cycle. But the actual infrastructure's role in access is very significant, and the design at an urban level is important. Of course, 3 is fairly obvious. You have a set of assets around schools and sports stadiums and arenas and facilities, so it's a question of how they're utilized. And then they have to be programmed. So what happened in the last recession was that we significantly defunded parks and recreation. And the result of that was that the private sector has stepped in, and it's done what the private sector does, and it's focused on where the opportunities are in that marketplace. But without the programming previously offered by Parks and Recreation, facilities that may still be well maintained and look good now are more expensive for people to use. So we've lost the public commitment to funding sport and recreation at the programmatic level, which means that we're left with a system that is designed towards elite and towards capitalism, which in many ways has been fantastic and is fantastic, but it's not enough, because programming where kids can play, not just the place to play, but where they can develop competence, so they can develop confidence, so they can engage in activity for a lifetime. Those programs are something that have fallen out of the budgets of most municipalities and have not rebounded since the last recession. Now we have another pending financial crisis for municipalities, and I think the fear is that this will only continue. And then 5th is multimodal transportation, and we've talked a little about that. But these access factors, we've been informed through the work of Aspen and Dr. Lee as we consider these access factors, all to help communities think more broadly about how they are participating in, contributing to, and funding or using partnerships, and in particular in the medical sector, using partnerships to promote wellness in their communities. We can go to the next slide. So to do this well at a community, it's a multi-stakeholder approach. And I don't know of anyone that's more significant in that multi-stakeholder approach than a major medical partner. In communities where we are directly impacting health and social outcomes for people at every socioeconomic level, in communities where we're activating programs that include a metrics-driven focus on wellness, there is a major medical partner involved. Those medical partners are interested in these facilities not simply because of sport and sports medicine, but because these facilities provide massive amounts of inventory of time to provide wellness and preventative programming, and to engage with the marketplace in very different ways. And so it's with this multi-stakeholder approach that you end up with a model for sport and recreation that actually starts to reach those who are most in need of it. We can go to the next slide. Inspired by Dr. Lee, what we did, and directly in line with Dr. Lee, we knew that parks directors in particular don't have much of a voice in the budgeting cycle. They'll walk in and they're often well educated in the programs they offer. They'll give anecdotal or even data-driven reports on how many kids played, and they're using numbers, not percentage, and they're not necessarily reporting on what neighborhoods or where those kids came from. And what we knew is we had to equip and empower parks directors and advocates with tools that could help them express the value of recreation and sport. So our focus is to express the value of these activities. And we produced for the first time these calculators, now deployed for every park in the state of Florida, soon in California and the state of Kansas. But with a few inputs, parks director and parks official is able to get back a report which shares how that park contributes to property values, healthcare savings, environmental, tourism spending, public spending, and jobs creation in the community. This is the kind of data at the ground level that I think systems modeling has inspired us to try to activate. And the result of it has been literally billions of dollars in public investment into sport and recreation assets. So it's very exciting to see how this approach, which we frankly knew nothing about without the education of Bruce and Tom and others, can now is impacting in a real way activity levels and access for, we have 25 million visits a year in our facilities alone, but for a large number of kids.
I want to thank Bruce and I want to thank Dev, who camera. Sorry about that. So I want to thank Bruce and I want to thank Dev for their incredible work in helping power Project Play. It's been really essential. Bruce's data, I can tell you, has been used by the Ralph C. Wilson Jr. Foundation to talk to business leaders about the value of co-investing in this space with them. It's been great, and Dev's that on the ground person who can really bring back knowledge to us and also share out our work. So I really do want to thank them. So it's the good news is from all of this work that this broad network has done since really 2015 when the Sport for All, Play for Life report was launched. We've seen a lot of activation. More than 100 organizations have taken action guided by the playbook, and honestly, it's a lot more than that. That's just from one survey we did, 2.5 years ago. Professional leagues, ESPN created an access to sport prong to its corporate social outreach, helped inform Disney's strategy as well. We've seen, cities and counties begin to design their grants and their policies with the Project Play framework, 8 strategies in mind. Just this week, Montgomery County in Maryland, guided $1.5 million of their grant making based upon these strategies from what we read. It has helped unlock the foundation dollars and corporate grant making because people actually get sports in their bones in this country, but they often don't know how or where to invest or how to measure success. So that's a real benefit in pushing a lot of data and taking a systems approach to our work, as it has allowed more money to flow into the space. Community sport providers have revised their programs. The Trump administration or the Health and Human Services pushed out the first ever national youth sports strategy. They cited our work and we informed them, we talked with them, shared everything we had. And it's a pretty good strategy. There hasn't been a whole lot of activation off of it, but it's been, intellectually, it's a good strategy. And best of all, we're starting to see the KPI at the center of Project Play start to turn. I mean, this is an incredibly ambitious project. I mean, the whole conceit is that we can change the numbers at a national population level in certain areas. One of those is children playing sports. You're going to see data that's released in I wish I could give it to you right now, on October 6th in our State of Play report that shows that kids in every income category are playing more than they were a year ago. And coaches trained, there's a major jump that you're going to see, which has been a strong focus of Project Play. And we're also seeing the percentage of kids who are physically inactive, who do absolutely nothing, according to the SFIA data that's captured household survey. That's trended down now for several years. Now, that's not to say that Project Play deserves any amount of credit. And when I talk about Project Play, I'm talking about the broad network of organizations that have activated against it. But hopefully we've been a positive in organizing the thought in this space. And we'll encourage everyone, if you want to learn more about it, we've got our Project Play Summit coming up here, October 13th through 16th. It's all free. It's all online. The workshops are all sold out, but we've got an amazing set of speakers who are going to digest these findings, and we'll talk about taking next steps in building healthy communities through sport. So, thank you.
Hey, Tom, I'll just comment briefly. You said, I know we got to go to Q&A. You said Project Play has made such a difference. But with COVID, we have a new reality ahead. There are 150 or so YMCAs that are going to close nationally. We've had thousands of pools close over the last couple of decades. And with municipal budgets tightening as they will, we're going to watch continued reductions in parks and recreation budgets that may take us backwards very quickly. So these initiatives and things that we're talking about today, I think couldn't be more urgent and important for us to be working at the community level to activate than they are now, because we're going to watch a slide in access. It's just the result of the economy.
Just it's really an argument for taking a systems approach, applying the principles of collective impact, following the data. Yeah, we need that more than ever now.
Yeah.